Hey everybody, it's me again. So I am here today talking about what recreational therapy is, because last video I did say a little bit about my background in terms of what I went to school for. I do have an honors degree in recreational therapy, as well as I have a diploma prior to that in counseling. So that's pretty much my background, is therapy and counseling, as well as recreation. So it's like all over the place. Oh my god. So what is recreational therapy? I will explain in my own words, because you can probably Google it and I'm sure you'll find something even similar. But in my perspective of what it is, it's pretty much using leisure and recreation to increase the level of wellness in an individual. So basically what a rec therapist does is they'll do a patient assessment, patient or client assessment, depending on what area you're working in. And from that, you'll assess the person's individual needs, see what it is that you can do in terms of what they maybe used to like to do prior to an injury or illness or something like that, that'll increase their level of wellness. So maybe it's something that they used to do that they no longer can do because, I don't know, they're going to therapy somewhere. Like, let's say they're getting hemodialysis. I worked in hemodialysis, so it's a little tricky because you're hooked up to a machine for 4 hours. So thinking outside the box to get somebody to do something without screwing up the machine, right? So it's trying to get that person happy again, trying to get that person feeling better about themselves, about what they're going through, and hopefully turning that negative into a positive. And then ultimately the goal usually is to increase the level of wellness to the point that they're good and they are good on their own. So yeah, so it just depends on the area though that you're working in. There's a lot of different areas you can work in as a rec therapist. So you can work in a hospital, different types of patients there. You can work in either, let's say, geriatrics. You can work with oncology, hemodialysis, anything and everything pretty much in a hospital. Outside of the hospitals, you're looking at, I guess, rehabilitation centers, so you can work with people recovering from injuries, let's say brain, spinal cord injuries being the most severe. And then you can work with people that, I'm trying to think, people that maybe are recovering from a sprain or joint problems, people that have been in sports and tore a ligament, so trying to get them better. So basically it's really great because it's well-rounded. You do learn a lot. In the degree you learn quite a bit. You learn so much information because you have to know a lot about illness. You have to know what types of medicines contradict others. You have to know about even what medicines people would take on when they're in certain situations, understanding the background to a lot of the illnesses. You have to know your psych, you have to know your anatomy, physiology. Yeah, you really do have to know a lot and really have that empathy for people. You can't just be somebody that's sitting there and not caring. So you have to really put yourself in somebody else's shoes and kind of understand it from their perspective, because a lot of the times these sessions may be frustrating to somebody, and you have to work around that frustration and try to find a different way to approach the situation at that point. Because you don't want to make things too hard, you don't want to make things too easy, you want to always find that middle ground. So that's one thing that's really difficult with being a recreational therapist. But it's great because you work alongside people that are in other professions as well. So you'll usually work with doctors, SSWs, PSWs, OTs, and PTs. It's often a team, collaborative, because everybody's kind of working towards the same goal, right? Everybody wants the person to be better, and you just find different ways of doing it. rec therapy though is the fun way because we're using things that are fun. What a lot of patients would say was they were so happy to see me because I would be the one to bring them something to do, right? So they were excited, which is, it's so nice. At the end of the day, it makes you feel really good, and it can be frustrating at some points, but it's a really rewarding profession. Now for next week, hopefully you liked what I just said now. If you have any questions, you can let me know. I'll try to make an effort to answer them as best I can. If I don't know, I will refer you to somebody who would. For next week, I will be having a video with basic steps for Zumba. So we're gonna be doing more dance next week. And if you are new to my classes, and you have said you have 2 left feet, well, after next week you won't, because I will break down those moves so that you could be like a superstar in my classes. All right, so if you have any questions, leave them in the comments below and I will answer them as quickly as possible.